Hello friends, today we are going to discuss here about radiology MCQs. These are MCQs previous year NEET PG and other examinations. So let's begin. A relationship of femoral artery, femoral vein and sphinx vein at sphenofemoral junction is known as Mickey Mouse sign, steamer sign, Telok sign and string sign. So guys, if you score at least 70% marks in this section, that means in exam definitely you are going to crack NEET PG. 70% is minimum here. So which one is the best answer? You can pause this video and try to answer in a comment section. Okay, and also write your score is how much. So answer here is Mickey Mouse sign. This is an Mickey Mouse sign. Okay, this is due to and common femoral artery and common femoral vein and great sphinx vein, sphenofemoral junction on ultrasound. Hope it's clear. Now Roentgen is a unit of radioactivity, radiation exposure, dose equivalent or absorbed dose. So guys, 30 seconds in your hand, try to answer what is the single best answer here. This is all about radiology important MCQs. Okay, so guys, what is the single best answer here? And if someone is interested, they can join my program for INI-CET 150 high yield videos subscription program, and for NEET PG is 200 important videos, and charges are 5,000 for that. So answer here is radiation exposure for this. Now pregnant lady underwent single accidental exposure to X-ray at 7 weeks of gestation. What advice will you give to her? Continue pregnancy, termination of pregnancy, pre-invasive investigation or karyotyping. So which one is a single best answer here? So guys, all 4 options in front of you, and such subject wise videos previous year MCQ I am going to bring all 19 subject videos as soon as possible in this month. My target to bring all videos before your exam. So answer here is continue pregnancy, because single accidental exposure X-ray is not a fatal complication, so you can continue pregnancy. Now personal monitoring of radiation dose is done by lead shields, TLD badge, Linac, gamma camera. So which one is the best answer here? If you want, you can pause this video and try to answer in the comment section. And guys, please write your score also, how much you score in this video, how many correct, how many true. And answer is TLD batch. Okay, dosimeter, transluminescent dosimeter. A non-ionizing radiation among the following is MRI, CT scan, X-ray, positron emission scintigraphy. So which one is the single best answer here? So guys, please don't forget to put like on this video if you like this video, and if you put like, it gives me motivation to bring such more videos subject wise. For all subject I am going to bring, definitely so many MCQs you are going to receive in exam from this. Or so answer here is MRI. This is MRI is a non-ionizing radiation among the following. Now identify the following procedure shown below. This is barium meal follow through, barium enema, anthrocalysis or proctography. So which one is the single best answer here? Try to answer in a comment section. And also I explain, if you score 70% marks, that means definitely in exam you are going to score excellent. So this is barium meal follow through. This one is a barium meal follow through. Now what would be the contrast of choice in esophageal perforation? Gadolinium, iohexol, barium or water? Which one is the single best answer here? So guys, if you want to join that program of 200 important topics for NEET PG or 150 topics for INI-CET, how to join that program? In this video description I provide the details. So answer here is iohexol. Okay. Barium meal follow through is helpful in diagnosis of colonic stricture, rectal stricture, ileal stricture, esophageal stricture. So barium meal follow through image we already seen today in this topic. So answer is, this is mainly used for guys, if you want some time you can pause this video for 18 seconds and try to answer in the comment section. This is ileal stricture. Now T2 image in MRI is detect pathology, detect anatomy, or good for both, or good for none. So guys, try to answer in the comment section what is the single best answer, and I am going to explain you how to remember this answer. So T2 image of MRI is good for pathology, not for anatomy. Alphabet A, anatomy 1. So T1 image in MRI, alphabet A is for anatomy and pathology is later. So second one is for detect pathology, if you want to remember by a trick. So this is a trick. CSF in 1, T1 weight, MRI gives following appearance: hypointense, hyperintense, isointense, or none. T1. So T1 weight MRI gives hypointense. T1 is hypo. Okay. Now Hounsfield number of water is 0, plus 100, minus 100, minus 80. So which one is the single best answer here? 0, plus 100, minus 100, or minus 80? Answer is 0. Water is 0. For air is minus 1000. For fat is minus 100. Okay. So hope you understand. Boot shape hurt in tetralogy of Fallot is due to left atrial enlargement, right atrial enlargement, right ventricular hypertrophy, biventricular hypertrophy. So take your time, try to answer in the comment section which one is the single best answer here. So the single best answer here is right ventricular hypertrophy. This is due to right ventricular hypertrophy. Now all of the following produce pulmonary oligemia except TAPVC, tetralogy of Fallot, ASD, tricuspid atresia. So in which of the following we are not going to see pulmonary oligemia? That is TAPVC. Okay. Now clear. The following abnormality of aortic knuckle is seen in this chest X-ray. This is TGA, PDA, coarctation of aorta, PAH. So what is the single best answer here? Here you see, let's see, I am going to draw this X-ray this way. Okay, this way. So what is this? This is sign 3. Sign 3 is seen in coarctation of aorta. Rib notching seen in coarctation of aorta. Hope it's clear now. Identify the infection from the chest X-ray of patient with low grade fever. ILD, ischemic lung disease, interstitial lung disease, or bronchopneumonia, miliary TB, or consolidation. So hope this chest X-ray image is clear and this is easily visible. This is a case of miliary tuberculosis, miliary TB. Okay, these dot small consolidates. Now all of the following are seen in X-ray of left ventricular failure except syphilization of blood flow, curly B lines, cardiomegaly, oligemic lung fields. So what is single best answer here? Guys, try to answer and you need to be quick. So answer here is oligemic lung fields. Now a 45-year-old female present with chest pain and breathlessness in the ER below the representative CT scan. What is the most likely cause of her symptom? So guys, if you don't know the image, how to identify an image, at least listen the language of question. Chest pain, breathlessness, 45-year-old female. This indicates what? Embolism. This is a case of pulmonary embolism. So answer is pulmonary embolism. Very fast here. Now radiographic sign characterized by pulmonary edema is, so bat wing opacity in pulmonary edema already mentioned in this, sorry. So look like this is bat wing. Bat wing is seen in pulmonary edema, whereas Hampton's hum seen in pulmonary embolism. Pulmonary embolism. Now, CT scan of abdomen showing the structure marked is. I hope it's clear. This marked structure. Superior vena cava, inferior vena cava, aorta or thoracic duct. So, which one is this? This is an what? Inferior vena cava. This is an inferior vena cava. Now, which artery has been shown in the following CT angiography image? Superior mesenteric artery, inferior mesenteric artery, inferior rectal artery or celiac artery. So, which artery is seen in CT angio? This image. So, here we are going to see what? This is a case of superior mesenteric artery. This image is superior mesenteric artery. Now, chain of lake appearance seen in acute pancreatitis, chronic pancreatitis, carcinoma pancreas, ductal adenoma. So, what is the single best answer here? Chain of lake. Okay, chain of lake seen in chronic pancreatitis. In case of chronic pancreatitis. Now, corkscrew appearance on radiography is seen in achalasia cardia, carcinoma esophagus, hiatus hernia, diffuse esophageal spasm. So, let's discuss all four options here. In achalasia cardia, you see what? Beak bud. In carcinoma esophagus, you see what? Red tail appearance. In diffuse esophageal spasm, we see corkscrew appearance on radiology. Okay. Now, name the investigation shown in the image. MR HSG, CT HSG, USG HSG, conventional HSG. HSG is hysterosalpingography. I hope everybody know. So, this is a case of conventional HSG. Conventional HSG in this image. So, I am going to take. This is a conventional HSG. Now, identify the condition in the image: lacunar infarct, multiple sclerosis, brain tumor, intracerebral hemorrhage. So, this image shows what? I am going to zoom this image. So, what is this image represent here? This shows lacunar infarct. Okay, this shows lacunar infarct. Now, this is very important. Elderly patient present with severe headache. Remember, severe headache, neck rigidity. CT is shown below. What is diagnosis? EDH, HDH, SAH, meningitis. Extradural hematoma, subdural hematoma, subarachnoid hemorrhage. So, this is a case of what? Subarachnoid hemorrhage. This is a case of subarachnoid hemorrhage. A 8-year-old child with bitemporal hemianopia. His IQ is normal. His visual acuity is diminished. Radiological image. This patient shows. What is the most likely diagnosis? If radiological image is not given, they ask bitemporal hemianopia, normal IQ, visual acuity diminished. So, this is a case of craniopharyngioma. This is a case of craniopharyngioma. Now, a child presented with defective vision and headache and CT showed suprasellar mass with calcification. What is the diagnosis? This is a case of, what is the diagnosis? Meningioma, astrocytoma, craniopharyngioma, oligodendroglioma. So, what is the best answer? This is a case of craniopharyngioma. This is a case of craniopharyngioma, suprasellar mass with calcification. Okay. Now, identify the condition shown in CT scan image below. Dandy-Walker syndrome, vein of Galen malformation, Arnold-Chiari malformation, cerebellar vermis malformation. So, what is this? This is a case of, hope you know, vein of Galen malformation. So, B option is the right, vein of Galen malformation. Now, a patient presented with a history of diplopia and restricted eye movement. A clinical image CT image shown below. What is the diagnosis? leaf-out fracture, fracture maxilla, fracture zygomatic, or blowout fracture. So what is this? This is a case of blowout fracture. This image is for blowout fracture. Now, Bragg's peak effect is seen in X-rays, neutrons, electrons, protons. Which one? Bragg's peak effect. So this effect is mainly seen in case of protons. Now, most commonly used radiation in radiotherapy is X-ray, beta, alpha, or electrons. Radiation in radiotherapy, which radiation? That is, which one? X-rays, guy. X-rays. Permanent implant for brachytherapy are all except cesium 131, gold 198, radon 222, iridium 192. So what is single best answer here? Guys, if you really want to know some new updates and new MCQs pattern for exam point of view, you can take subscription of 200 important videos for NEET PG and 150 for INI CET. They are very high yield videos and lot of probability to receive MCQ from that videos. So you can take subscription of that video. So answer is iridium 192, except they are asking. Now, remote afterloaders is employed with reference to EBRT, brachytherapy, proton beam therapy, nuclear scintigraphy. So remote afterloader is for brachytherapy. They are previous year MCQs. Okay, so now new updates, every year new updates, such. So a female with a stage 2B cervical cancer underwent radiotherapy. Which of the following is true regarding it? Small vessels are resistant to radiation. Dose of radiation at a point is inversely proportional to the square of its distance from the source. Spares actively dividing cells. Rectal and vaginal mucosa are resistant to radiation. They are asking true statement. So guys, 30 seconds in your hand, try to answer in comment section. So answer here is dose of radiation point inversely to the square of distance of source. So B option is right here. Now, mode of administration of radioactive iodine is intravenous, subcutaneous, oral, or D, all of the above. So which mode? Take 30 seconds and try to answer in comment section. So best answer here is all modes. Acute myocarditis scintigraphy is done with thallium, technetium, gallium, or none. Guys, if you like this video, put like on it. If more likes, it gives me more motivation to make such more videos on all subjects. So I am going to make all videos regarding medicine, etc. All 19 subjects I am going to cover. This is first subject which I start today, MCQ previous year. So answer here is gallium. Now, half-life of tritium is 10.2 years, 12.3 years, 15.5 years, 20.7 years. So which one is the single best answer here is? Answer is 12.3. Tritium is 12.3. How to remember tritium? Tritium means 3. So 12.3, 0.3 which option? That is tritium. So this is a trick. Now, gamma knife utilizes strontium 89, iodine 131, cobalt 60, and P 32. Which one is an answer? So for gamma knife utilizes cobalt 60. Now, all are true about stereotactic radiosurgery except X-rays are used, a form of radiotherapy used in AV malformation, damage to nearby structures insignificant. So guys, try to answer this question in comment section and also write your score, how much you score in this video. All questions, how much you score. If you score 70, that means good score. And if you put like on this video, so it gives me motivation to make more such subject wise videos. This is all about radiology. One day before exam, don't forget to watch this video, or 2 days before exam, because all 19 subject I am going to put such videos, so at least 5 days you need for revision. And if you are interested to take 200 important topics, short summary, one video around 5 to 6 minutes duration, or some not more than 10, all 19 subjects are covered there. Theory I explain there and MCQs I discuss there. So guys, thank you and good day, goodbye. Don't forget to subscribe this channel.